everybody. I'm Shelley Yates with Dr. Derek Jones' office, the facial plastic surgeon, here on Dr. Make Me Beautiful. We're joined today by our co-host, Dr. Mark Lees, and welcome. And we are excited about this show because we are talking about problem skin.
We sure are. Problem skin is really my favorite thing to work with, and it's kind of what got me started with the national speaker circuit and my line and all of that. Books. My approach to problem skin, I don't know if that, within the industry, people sometimes call me the acne king. I'm not that, I think, depending on where you are in life as to whether or not that's a great title, but I'm going to take it as a great title.
Okay.
But I've spent a tremendous amount of time working with acne, different types of acne and different types of problem skin, and especially designing skincare for people who have problem breakout prone skin, which is really what I do. When I first started my practice here in Pensacola, I was finding a lot of people who needed a moisturizer. They were 30-something years old, but every time they've used a moisturizer, they broke out. We kept doing the same story over and over again. They really wanted to use anti-aging products, but anti-aging products made them break out. So that's kind of when I started tinkering and making products, you know, because there's got to be a way to treat this without making people break out. So, but because of that, I've spent a lot of time with acne and clogged pores and trying to understand them better, and we understand a lot more than we used to about it, and we also know how to manipulate it now. So a lot of it is genetic, but you know, we can work with it.
And you've been doing this for 30 years here, right?
Yeah, just about. Yeah.
And you've written many books.
I've got 3 books out right now, and one of them is called Clearing Concepts, which is designed for estheticians and dermatology nurses about. You know, just the whole book is about acne and contemporary acne too. I mean, everything from foods that may or may not affect acne to genetic stuff to hormonal stuff to cosmetics and how they affect acne.
Right. Well, tell us a little bit about that. What causes it?
Yeah, well, let's go to some slides because I want to, we have this broken down.
Okay.
And try to, oops. Okay, the first fact is, we have a few facts we want to look at. First thing is that acne-prone skin is genetic, it's hereditary, okay? We inherit 2 things that cause and affect acne. One is something called retention hyperkeratosis, which is the cells, instead of normally shedding off of the skin the way they're supposed to, they have a tendency to stick to the skin, and especially inside the actual follicle. Okay. Follicle is what a lot of people call pores, but pores is a consumer term. Okay, but they build up on the inside of the follicle, and this causes a narrowing of the airway into the follicle. And then the second thing that's genetic is the same people make too much oil. Make too much facial oil or sebum, okay? So the sebum actually, as it's secreted by the oil glands, coats over the cell buildup and causes more thickening to occur. And I've got a little graphic here that kind of shows you the way it works. And in box 1, that's a normal follicle, okay? Very clear, air is easily getting in and out of the follicle. And as we see in box 2, we're starting to get cell buildup on the follicle wall. And in box 3, it gets thicker and thicker. And in box 4, you can see the sebum kind of mixing with it. And sebum is very easily oxidated, which means that it causes a darkening of the sebum because it's a fat. And this causes a solidification of the actual oil. And it kind of works as the same way as chicken fat. If you boil a chicken and you're keeping the drippings for a soup later on, you stick it in the fridge and you know how it solidifies?
Yes.
And that's the fat, okay? So fat gelatinizes very quickly when it's exposed to air. And this is what causes that little plug to form when we get a blackhead or a clogged pore. Number 5, box 5 is what we call a microcomedone, and this is the actual beginning of the acne lesion. This is a baby zit, okay? And it's deep in the skin, and this is where the cells clump together. And the unfortunate thing about this is we can't see these. So one of the big mistakes people make when they try to treat their acne at home or try to treat their clogged pores at home is they only treat what they can see. And for every clogged pore or blackhead or whitehead or pimple that you have on your face, there are literally hundreds of these up underneath the skin.
Great.
They're just like little shark's teeth. You know how a shark loses a tooth, another one just pops out?
It's just like that.
Just like that,
Oh, that's
okay?
good.
So the key in treating clogged pores or acne is that you have to treat all of the clogged areas, not just the actual zit that has matured. Box 6, that's a blackhead, typical blackhead. And it's just a dilated follicle. The black tip on a blackhead is mostly melanin or skin pigment, and it's just the skin's reaction to the fact that that clog is there. So it's almost like a little immune response.
Okay.
If we go back to box 1, we've got a really clear pore. In the bottom of every pore, there are acne bacteria. And they're part of the normal flora. They're part of the normal little guys that make up things that stay in your pores all your life. And usually don't cause a problem, but if oxygen gets blocked from the bottom of the follicle, they are anaerobic, so they cannot survive in the presence of oxygen. So when you have an environment that is deprived of oxygen, they go nuts. They proliferate. So as long as that follicle's clear, air is getting down in the bottom of it. When you look at slide 7 or box 7, you can see how stuffed that little thing is, okay? And that's what we call a closed comedone. One of my teenage clients used to call these undergrounders. And they're the little bumps up underneath the skin that you can see if the light hits you right.
Yes.
If you have acne-prone skin, a lot of people have them in their cheek area primarily. And these are closed comedones, and basically they're a buried blackhead is what they are. But they are also the lesion that most often will turn into a zit because the follicle opening, the top is so tight, it's extremely hard for oxygen to get down in there, and because of that, the acne bacteria go nuts. Acne bacteria only eat one thing, and that's sebum.
Oh.
So as long as you've got a little packed follicle full of, I always say, a buffet of sebum for them, okay? They have sustenance, okay? And they eat, and when they eat the sebum, they throw off fatty acids, which actually inflame the inside of the follicle. And that little impacted follicle gets more and more swollen from all of the stuff that's going on inside it until, as you can see in box 8, there's actually a rupture in the follicle. And that from box 7 to box 8 is when a zit turns red.
Okay.
So in box 7, that's just going to be a little lump up underneath the skin. When the rupture occurs, blood comes into it to try to rescue the follicle with the immune system, and that's when a zit turns red. So the box 8 are those big sore ones that aren't ready yet, kind of thing. That's what box 8 is. And then box 9 is a pustule, which is once the white blood cells have had a little bar brawl with the acne bacteria, a lot of them die. And pus is mostly white blood cells and some serum, some blood serum. But that's basically, this is basic zit anatomy.
That is the evolution.
Right, evolution
pimple.
of a zit. Right,
Zit,
exactly.
right.
This is pimple anatomy.
How do we keep it at like a number 1? How can we?
We have to use something that sloughs the follicle out, something that breaks up that cell buildup. Because remember, because it's genetic, it's what I call a forever factor.
Okay.
In other words, you're always, if you have acne-prone skin, you will have acne-prone skin for a very long time.
Right.
Okay. There's nothing magical that I can give you that will clear it permanently.
Right.
And there's the closest thing to a cure for acne is Accutane or isotretinoin, which is, as we know, has a ton of side effects, and most people do not want to go there. And for cases of cystic acne, it's still, I think, the best drug there is. But most people don't have cystic acne. Most people have mild to moderate acne, which is what we deal with. So the key is keeping this, controlling the oil and keeping the cell buildup sloughed out.
Okay.
Okay. And then you have to stay on this stuff to keep it from, to prevent it from reoccurring.
Okay.
So the first couple, 3 months that you're using our program, we're breaking up the cell buildup. And then after that, as far as maintenance is concerned, you're doing something every day that just keeps that sloughed out so that those follicles don't reclog. So this is great for somebody, this program that we're going to show you is great for somebody who has clogged pores or mild to moderate acne.
Right. Now, I have teenage sons, and how do I convince them to slough their skin every day? I mean,
Well,
that's
it's just a
difficult
program,
thing.
and it's, you know, in teenagers, we try to make it as simple as possible, particularly younger teenagers. But they have to, you know, they have to comply. It's just like
Right.
anything else with medical treatment or health treatment. You have to, you know, you're not going to lose the weight if you don't go to the gym.
Well,
you
that's
know,
true.
it's the same
And
thing.
nobody wants to have pimples. So.
No. But I think, you know, most of the time when teenagers start being attracted to other teenagers,
right?
then they start caring, and then they'll listen.
Yeah.
You know.
So might as well just go ahead and do it now.
Right,
Because that
and
day's
just
coming.
again, try to keep it as simple as possible. We
Okay.
can do that. Okay, there's a lot of hormonal factors in acne-prone skin, and hormone fluctuations, and particularly male hormones, are what stimulate the sebaceous gland. They're
Right.
what cause the sebaceous gland to turn on. This is why women get pimples during their time of their period,
Okay.
or before their period usually, and it's because there's a surge in the percentage of male hormones during that time, 7 to 10 days before the menstrual period, and this causes a surge of oil. The oil itself can irritate the follicle, and that irritation can cause the walls to swell, and when they swell into each other, and when they swell into each other, they cut off the oxygen.
I gotcha.
Okay, and stress causes hormone fluctuations. A lot of people say, "Well, I've got zits because I'm under stress."
Right.
Well, it's not. It's an indirect effect because
Right.
stress causes hormone fluctuations, especially in women, because in women, most of your male hormone is made in the adrenal gland, which is also your stress gland. So when your adrenal gland is in overdrive because you're under stress, the whole factory is in overdrive. Okay.
Right.
So you're not only making cortisol to deal with the stress, but you're also making more male hormone.
Right. Well, hey, listen, let's take a quick break and come back, and then we'll keep going. This is fascinating.
Yeah, that's great.
Stay tuned. Welcome back, everybody. I'm Shelley Yates here on Dr. Make Me Beautiful with Dr. Mark Lees, and we are talking about problem skin.
Yes, we are. And we were just talking about the genetic effects that we fight, what I call forever factors, the cell buildup and the oiliness that basically causes acne. But I want to go to some other factors that are some outside factors that we also can try to control. Acne can be caused or worsened by some skincare and cosmetic products.
Right.
And this can either be in the form of inflammation or in the form of that the skincare product may sort of mimic sebum, and it falls into the follicle, basically kind of coats over the cell buildup just like the sebum does. So now we only have coating coming from the inside, now we have coating coming from the outside.
Right.
So you do have to make sure that your products are not clogging the skin. This is mainly for my professional group that I lecture to, but these are some of the chemicals that we avoid when we're
Coal tar
formulating.
would be my
Coal tar is a pretty good signal. Actually, coal tar is the basis for most forms of red coloring in cosmetics. So the redder a blush is, for example, the more likely it is to be clogging to the skin.
Wow.
Okay. Most of these other things are spreading agents. They're things that spread whatever it is across the skin. So they make up the majority of the product because they are the actual, what we call a vehicle.
Okay.
For like if you have a sunscreen, the sunscreen ingredient's not up here, but it might be in a vehicle that contains isopropyl myristate.
Right.
Okay, and that would be the isopropyl myristate is what falls into the follicle and causes a problem.
And what is a highly comedogenic? I know you've gone over comedogenic in the past.
Comedogenic means a tendency for an outside topical substance to clog pores.
Okay.
Basically, so these are ingredients that are known to be highly comedogenic.
Okay.
And these are ones that are moderately comedogenic. Okay.
I've seen,
there
yeah,
your DNC
sure.
red pigments, soybean oil, in a large enough quantity can cause a problem. So this is for me to worry about primarily
Right.
because everything I formulate doesn't have this in it.
Well, that's what I think people
So we
should
just
walk
take
away
the
with
guesswork
this.
out
Yeah.
of it for you, So number one concept in treating the acne is we want to eliminate everything that's comedogenic. And a lot of times the way to do this is to make sure that whatever you're using has been tested and shown to be non-comedogenic and non-acnogenic. And if you come to us, we take all the work out for you because we've already done all the work.
Exactly.
So we can help you make those decisions. The concept number two is what I talked about before, the use of follicular and surface exfoliants to slough out the follicle or evacuate debris from the follicle and allow aeration of the follicle. And we have a number of products that we do this. We're not going to have time to go into all of the products today, but that's what we do for a living.
Right, so people can come into the salon.
And we can help
yeah,
them choose the right one that's the right strength for them. And,
write up a plan and
exactly.
A way to use
Okay.
it, yes.
A lot of people have something called clogged dehydrated skin, and this is skin that tends to be very clogged, but has a lot of wrinkly things and going through some aging things. Breakout prone skin that needs moisture, and I need a moisturizer, but every time I use one, it breaks me out.
Right.
So we deal with that. This is a typical clogged dehydrated skin.
Okay.
So it's not really what most people would consider acne. I guess technically it's acne grade 1. But it's very clogged, lumpy looking, and wrinkles and stuff like this are going to look a lot worse on
Yeah,
somebody
I
who
notice in the
has-
winter my face looks wrinkly.
Yeah,
more
that
so.
you get a lot of cell buildup on the surface of the skin. And what we do here is effective cleansing, staying away from the clogging products, of course, the follicular exfoliation, using a lot of hydration. And these are water binders as opposed to oils.
Okay.
So your moisturizer should have a lot of water binder in it and very little emollient, because everybody who has this type of skin is already making too much emollient, okay? And daily sun protection, as you know, I preach all the time. But even your daily sun protection, if it's put in the wrong base, can cause issues. So we try to do that. I want to take you through some case studies where we've treated. This is some of our products that we use and this is a very typical kit that someone of an adult might get.
I
This
love,
is an adult
I love
kit.
this stuff. It's so awesome.
Thank you, thank you. Well, we try to have something that's cosmetically elegant, that works well under makeup, that feels great and things like that, but is also good for you. That's the point. And these are just this is a clogged dehydrated client. This is after 6 weeks of using our products. You can see a refinement. Now these were done without treatment. This is strictly
Just product.
just the product alone. Another clogged dehydrated. You can see how much clearer they are
Yeah.
after just about 6 weeks for most of these. Some of these are a little longer. That's the one we saw before. This is somebody who's, they're not teenagers.
Right.
These people are in their 30s probably. And look at that after.
Yeah.
Just being on a program for 6 weeks, we're able to refine the skin that much and get that. Also deal with types of clogging on the body. This is a condition called keratosis pilaris.
Yeah,
We make a
okay.
product for that, and this is after 4 weeks of using our resurfacing lotion. And it's something he does twice a day. This is, if you look in the upper left hand, the upper slide, you see a lot of clogged pores in the temple area, just above the temple
Right.
area at the end of the brow there. And this is after. Now, this one we actually treated with a series of light chemical peels too. So this is an alpha hydroxy series that we also use for treating clogged pores
It
as
looks
well.
really pretty.
Yeah, it looks a lot better. Now, these are some of our slides. The Paul Mitchell School in California works with us a lot, and we do a lot of our case studies there. So these were some of the Cosmo kids that volunteered for a study, which is interesting for them because they understand how study takes place. And we took them off of everything they were using and put them on our acne kit for. These are 11-week slides, and you can see a
Wow,
huge
yeah.
difference. And again, they're not supposed to have any treatments during that time. All they're supposed to do is use the products. And of course, we do the treatments, it speeds it up even more,
Right.
And these are just different groups of folks. This is just a 30-something-year-old gal who had inflammatory acne. She was
Right.
actually using something that was making her red, too.
Yeah, it looks like a reaction
Exactly.
almost.
And again, 30-something-year-old gal who had, this is what we call grade 2 acne here. It's still considered moderate acne, but she'd had acne forever when we started working with her. And as you can see, this is again, so it's about 12 weeks,
Right.
about 3 months basically. It's not overnight. But
Right.
now the one thing we want to prevent though is for her to get to that point and say, okay, I'm cured.
Okay.
You're not cured.
Right.
You have forever factor. Okay. So if you stop, just like if you stop going to the gym, that muscle's not going to stay there.
Right.
Okay. And it's the same thing with problems with any type of skin, really, because aging skin's the same way. If you treat aging skin and you stop, that'll come back too. So basically, I'm going to go through a real quick facial. People want to know what we do for
I
problem
love
skin.
your facials.
This is coming into just cleaning off the skin first, an analysis. Sometimes we use a brushing machine, or we also have an ultrasonic device that we use sometimes. Sometimes we use a little light salicylic peel as another alternative. We're applying the Desengel, this is a solution that actually liquefies the plugs in the skin. And we steam with this on. Okay. This is a galvanic treatment that we use to get the solution deeper into the pore.
Oh.
Okay. And this, again, is to loosen that follicle so we can get the debris out. And these are clogs that haven't responded yet for some reason. This speeds up everything we just talked about.
Yeah, that's great.
And this is the actual extraction procedure that we do, which is using cotton swabs.
Right, and gloves. So
And we're all
little
gloved up. Yeah,
difference.
we are extremely. I mean, a lot of people are surprised that a salon would have an autoclave, but I can't imagine having a salon without an autoclave.
Right, especially when you're
Yeah.
fighting bacteria.
Right.
I mean, that's the
And-
last thing you want to do.
Right, and so we are we certainly believe in aseptic procedure. This is a high-frequency treatment that we use to calm the skin, helps with redness, also kills bacteria on the surface of the skin where we've worked. Sometimes we do a massage. Now, when we get somebody with, more clogged skin, we generally skip the massage.
It's a
because
clinical, more of a clinical
It's more of a
facial.
clinical treatment. Now, this gal here probably had a few clogged pores, so she can have a massage. But the stuff we're massaging with is non-clogging. So it's going to put a lot of water back into her skin, but it's not going to make her greasy. One of the nice compliments I hear about our line all the time is, I love your products because they do what they're supposed to do, but they don't make me feel greasy.
That's 100% true.
And they
why I
wear
love it.
well during the day. We
Yes.
spend a ton of time working on that, and it's always nice when somebody realizes it.
Yeah, well, it's
you
true.
know, that's just a nice thing that's one of my favorite compliments to get. Mass treatments vary with what we're doing. This is a clay base, so this one that she's using now is a cleansing mask, and it's designed for oilier areas and clogged areas. And this is her ready for a little nap.
Yes.
And we treat the eye area too while she's masking, and the throat. And that's her having her little nap. And at the end, we clean her off. And the last thing is the sunscreen. That's my sunscreen pattern right there. So when you put your sunscreen on in the morning, that's the way you want to dabble it, except you want to put 2 more dots on your neck. A lot of people forget that the necks are part of your face, and neck's getting sun just like everybody,
Right.
the rest of it. And your neck doesn't stop at the lower part of your ears, it stops in the back.
Yeah.
So to make sure you treat your neck, because necks are one of the first things to go in terms of
We
aging.
see a lot of problem necks
You do.
in Jones Facial Plastic Surgery.
That is true, and it doesn't surprise me. And of course, gravity has a lot to do with it too.
That's true.
Weight has a lot to do with
Yeah,
it. as
but
well.
if you were to take care of your skin,
it will be slower.
it will be slower.
And it will look better when you do get to that point where you get it lifted. It will look a lot more natural.
Right.
Because the skin's in such
Healthy.
great shape. Right, exactly. And that's it. And that's what we're all about. If you're confused about what's right for your skin, you don't know what you're doing, you reach to a point where you're saying, I need some help.
Right.
That's what we're here for. And skincare-wise, as far as our prices are concerned, I mean, we run the same as department store cosmetics or
Right.
something that you buy on home shopping. You
So-
know, same type of thing.
So people should come into the salon, make an appointment, and get an evaluation.
Right. Most people have a facial the first time, and
Mm-hmm.
then the evaluation is included in that. So that was the easiest thing to do, is to make an appointment to come in and have your consultation and evaluation done at the same time, and then we'll set you up on a program.
That's right. Get a program in place, and then if you have teenagers, just take them on in.
Yeah,
And,
we deal with a lot of teenage skin, and are very successful with it.
yeah, it's very easy, and you've done a really great thing for everyone.
well, thank you, Shelley.
How can
Appreciate
people
it.
get a hold of you?
Best thing is you can go to markleesalon.com or marklees.com online. You can like us on Facebook at Mark Lee Skincare. And our salon is here in Pensacola, is located in Cordova Square.
That's right,
And you're
centrally
welcome to
located.
drop by. Although we generally don't take walk-ins because we have a pretty tight appointment schedule, but we would certainly, that's what we're here for.
That's right. Well, thanks for joining us on Dr. Make Me Beautiful. I'm Shelley Yates for Dr. Derek Jones, and this is Dr. Mark Lees. And join us next time, won't you?